today we're going to open the program with a very important conversation. You know, this season is going to look different this year from last year because last year we are very much in the thick of a pandemic, and so we didn't really gather as much, right? This year, though, a lot of people are feeling safe to get together because of COVID vaccinations, right? But COVID vaccine and children, there's a lot of questions still surrounding that. The three most important questions, in my opinion, are: is it necessary? Is it safe? And do we have to do it now? So those questions and more will be answered by Dr. Joyce R. Javier, who is a general pediatrician at Children's Hospital, Los Angeles. And also she is an associate professor of clinical pediatrics and preventive medicine at Keck School of Medicine of USC. She's a general pediatrician and physician scientist whose research over the past 18 years has focused on addressing health disparities among minority immigrant populations. Her most recent studies focus on recruitment of Filipino families in randomized controlled trials and using community participatory research to decrease mental health stigma and prevent adolescent depression and suicide among Filipino youth by partnering with parents and community stakeholders to implement and evaluate evidence-based parenting interventions. So she's not just going to talk to us as a pediatrician, as a health expert. She's also going to talk to us as a mom, and she will share her personal opinion as well on COVID vaccinations and children. This is a very important conversation. This is So Informed. Thank you so much for joining us, Dr. Joyce Javier, once again here on So Jannelle. Happy Thanksgiving to you. I hope you had a good one. So it is the season of holidays. I feel like after Thanksgiving, we're all supercharged and the days just fly by, right? And we know that this is the season of giving, the season of togetherness. It's gonna look much different this year than last year because nowadays things are more open. People are starting to open up. People are starting to gather, but we still have to protect our children, right? What can you tell us about children and the COVID vaccine?
Thank you so much, Jannelle, for inviting me back to your show. I'm really excited to be here and talk about the COVID vaccine for children. For 5 to 11-year-olds starting November 2021, the COVID vaccine has been authorized for emergency use. And it's a 2-dose series, 3 weeks apart. And each dose is 10 micrograms, which is a third of the adolescent and adult vaccine. For 12 to 17-year-olds, the vaccine has already been authorized. More than 11 million adolescents have been vaccinated. For the teenagers, the dose is also 2 doses, 3 weeks apart, and that dose is 30 micrograms. And overall, it's the PFIZER vaccine that's available, and it is shown to be 90 to 100% efficacious in preventing COVID in the studies that have been done. And there were no cases of severe COVID during these clinical trials. And it's also known that these vaccines work against Delta and other known variants of concern, which have been rising. And I'm worried about this, upcoming holiday season, about seeing more of the Delta variant.
All right, so I guess the first question is it necessary? Do we really have to vaccinate our children, especially when they're saying that COVID doesn't really affect children as much or not as seriously as it does older people?
I highly recommend that parents vaccinate their kids for COVID because kids are not completely spared from the harm of COVID. So far, 1.9 million children have been affected, 8,300 have been hospitalized, and 94 have actually passed away, and even one child is one too many to pass away from COVID. So right now, it's actually the number 8 killer for 5 to 11-year-olds in the US. Also, there's an entity called long COVID or long haul COVID. Some studies show that 50% of teens and young adults may have these lingering symptoms, even 6 months after having COVID. So long COVID and also, missing school and the mental health impacts of the pandemic and, community transmission are also some negative impacts of COVID-19.
That's US. That's just
That's
US.
US. This is just
Yes.
US.
Right.
Yes, thank you for clarifying.
All right. So this is also serious for children, right? It's
It
just
is.
more serious for older people. And so I think, especially what you've said, you're making the case for parents getting their children with a vaccine. So the next question is it safe?
Yes, so the vaccine is definitely safe. Children can have experience side effects that are the mild and moderate ones, similar to what adults get after the vaccine, fever, fatigue, headaches, some diarrhea and chills, and some like muscle aches. And more children, just like adults, report these side effects like after the second dose compared to the first dose. So it is safe. I know there's a lot of talk about something called myocarditis, which is heart inflammation, because that has been linked to mRNA vaccines. This is very rare, and it's more common in young males and more common for the second dose. And usually the symptoms begin like 7 days after getting vaccinated. But the majority of cases have been hospitalized. No children have died of this myocarditis, and usually they'll recover within 34 days. And the most important point about that is, myocarditis due to the vaccine is much milder than myocarditis caused by COVID, which we have seen in children.
Let me just say, I've had my 5-year-old vaccinated and she's fine. So that's the first dose. She's fine. We're
Thank you,
getting her
Jannelle, for doing that.
after.
Yeah.
We have to do our part, right?
Yes.
Yeah. So we're
And
getting
I had
her.
my 11-year-old as well a few weeks ago, and she'll get her second dose on Monday. So I'm in the same boat as you, Jannelle. These are hard decisions. Mhm.
Exactly. For us parents, it's so difficult because I'm also hearing, and it was a concern for me as well. Like, what about long-term effects that we don't know about right now yet? Your thoughts
Yes.
on that?
Yes, that's a very common question that I'm seeing in my clinic. And I think it's helpful to understand that, mRNA, which is what the vaccine is made of, it does not change our DNA. The mRNA cannot enter the cells that we have where the DNA lives. And it actually like degrades within 72 hours of injection. So at this point, we don't know the long-term effects of the Pfizer vaccine. However, based on our knowledge of mRNA and the human body, we don't expect long-term side effects. And in the history of vaccines, because we have so many of them, serious adverse side effects only occur within the first 2 months of rollout. And we've had more than 12 months now of vaccine follow-up data through all the studies that have been done. And also thousands of people have gotten pregnant after vaccination. I know a lot of people are talking about, could it cause infertility? There are reports that the menstrual cycle may change after the COVID vaccine, and that's because the body is mounting an immune response, and this is likely a temporary side effect like a fever.
I'd like us to touch on that a little bit.
Mhm.
The myths surrounding the vaccine, because I've heard of that. I know of one particularly who doesn't want to get her child and herself the vaccine because it can cause infertility, according to her. Let's debunk myths like that now, because I really don't know where it's coming from either. But what are some of the myths as a medical professional that you would like for us viewers to know of and to debunk right now?
Yes, thank you for asking that. So, infertility, which I just talked about, the fact, another myth is that mRNA can change our DNA. And another myth is that kids aren't really affected that much by COVID. So we kind of already went through those three myths.
Mhm.
Another myth is, like, well, why did it happen so fast? And I think it's, important to understand that speed doesn't mean that this process was rushed. It really meant that we had to like mobilize a whole lot of people, money, and decades of previous work to get this vaccine in 9 months. So kind of the steps behind how these vaccines were developed is that we already had previous research on mRNA vaccines that started in the 1960s. Second, lots of money and resources for scientists around the world were mobilized. Third, production of the vaccines started before the clinical trials were even completed because the government financially supported the effort. Also, unfortunately, because there's high rates of disease in the community, we didn't have to wait for a minimum number of COVID cases to happen during the trials. And this is the thing I'm really proud of, and I'm actually one of those parents, is that over 150,000 people flooded to participate in these clinical trials. This couldn't have been done without each and every one of them.
Right. Thank you for debunking those myths. Some parents are actually not opposed to getting their kids inoculated, but they would rather wait. Is there an urgency?
That's an excellent question. I think there is an urgency because we are seeing that more and more kids are getting infected, with COVID, and the Delta variant seems to be affecting children, even more. The one thing that I worry about, which I mentioned to you earlier, was something called long COVID. Some data that I've seen is that if you look at for every 100,000 cases of COVID in children, over 7,000 children have had these long COVID-19 symptoms. And some of those symptoms are very scary. I can share some resources from the American Academy of Pediatrics on long COVID, but some of it includes what we call brain fog. So the children aren't able to concentrate at school, or suppose they were an athlete before, they can't keep up with their peers, they're missing a lot of school. So that is very worrisome when you kind of weigh what are the benefits and risks of getting the vaccine versus the benefits and risks of actually getting COVID.
Right. Which brings me to my question that I posed earlier, the pros and the cons. When you weigh it, if we can break it down, what would it look like?
I like to think about, okay, if we give 100,000 doses of the COVID vaccine to children, there have been 0 deaths. But if 100,000 children get COVID, there have been 5 deaths. If we give the vaccine, it's been associated with 0 cases of something called multi-system inflammatory syndrome, which is kind of like something called Kawasaki disease, where the body develops an immune response and it can affect the heart. So there have been 0 cases of that when you get the vaccine, versus there's been 92 cases of that per 100,000 children who've gotten COVID. Same for hospitalization. There's been 500 cases of hospitalization, 1,200 cases of the heart inflammation if you get the COVID infection. And again, that long haul COVID, over 7,000, kids have gotten long COVID. So I know it's confusing. It's a lot of numbers, but these are actually the things I go over when I talk with my patients individually about the vaccine.
Right. And I guess also for me, what made me want to do it is during this time when we're all getting together with grandparents, with family, with other children. I think the more we can protect, I think the better, right?
Yes, definitely. If not, do it for your child's health themselves. Do it for Lolo and Lola when they're going to visit, so that they're not bringing it to them from school. I think it's really, really important. And, the more people that get vaccinated, the more we'll be able to kind of hopefully return to normal, back to, how things were before the pandemic. But we're still kind of far from that, unfortunately, Jannelle.
Right. And also one other question, and this is also a question that often comes up when I talk to people, even with adult vaccinations, right? When you are vaccinated, COVID doesn't affect you as much, right? So it's not as severe as if you're not. But are you then able to still get it and pass it on?
It is possible for you to get it and pass it on, but it is much, much less likely. But it has been reported that it is possible. Very rare though.
Very rare. So even with children, if our children are vaccinated, it will be rare or less likely for them to pass it on to others?
Very, very extremely rare. Yes, that is correct.
But of course, we still need to wash our hands often, wear masks, right, Dr. Javier? I'll give you time for any last messages.
Yes, definitely. I think I have two, last messages. First of all, the COVID-19 pandemic has also affected, the mental health of children. According to the CDC, there's been a lot of children who've lost a loved one due to COVID. So that's like long-term effects on the kids. Also, emergency department visits for mental health emergencies have risen, as well as there's been a 50% increase in suspected suicide attempts among girls seen in emergency departments. So, we're trying to do work in the Filipino community because our community is at higher risk for getting COVID because we have so many healthcare workers and we live in generational households. So we're still doing work to kind of help, prevent the mental health impact on Filipino families. Second, it's very exciting for us to say as pediatricians that COVID-19 is now a vaccine preventable disease for ages, 5 and up. So if you are a parent out there and you're kind of waiting and seeing, or you're like, definitely no, first of all, please have a conversation with your pediatrician. They're there to listen and know the health and medical history of your child best. And then second, it's very important to seek reliable resources. I keep myself updated by reading the American Academy of Pediatrics, as well as your local epidemiologist. Again, I just encourage you to think hard about vaccinating your children. And thanks, Jannelle, for having me.